Welcome to EAU Podcast. In this episode, we are joined by Dr. Benjamin Pradere and Dr. Markus Eckstein. They talk how AI could improve our understanding of tumor complexity and bladder cancer pathology. Join us as we embark on this informative journey.
Dear friends, dear colleagues, it's a pleasure to have you again at the EuroOnco platform. Today we are at EMUC in Lisbon, in Portugal, and I have the honor to have Dr. Markus Eckstein with us. He's an assistant professor in pathology department in Germany. Markus, thank you very much for being with us today. It was a fantastic session yesterday on artificial intelligence and pathology, and you had a talk on how AI can improve the assessment and the understanding of tumor complexity regarding transcriptomics and proteomics. So, Markus, can you explain us how AI works in that settings and how you use it and how you see it?
Sure. Yeah. Thank you first for having me here. It's a great pleasure for me here, and indeed we had a great session yesterday about AI, how it's transforming translational research, but also pathology. And I think before we start jumping into complex spheres of proteomics and transcriptomics, we just can start a bit with AI and how we envision the use in pathology, for example. And I think there are pretty good examples where we already use AI in daily practice in pathology, for example, for core needle biopsies of the prostate, where it really can speed up processes in diagnostics, where we can use these algorithms from different companies to speed up diagnosis of cancer versus non-cancerous biopsies, or which can aid us to reasonable use immunohistochemistry, for example, as accompanying diagnostics.
And so AI is already used somehow in uropathology. How can you explain us how you use AI for these translational studies regarding the tumor complexity and how you see transcriptomics and proteomics, that all the audience understand this whole area that is very fascinating today?
Yes, sure. So when we're talking about AI in general, I think it is in general a wrong wording to talk about intelligence, because these algorithms are not intelligent. They are rather pattern recognition algorithms. I think that's very important. So we are using these algorithms, these software algorithms, to recognize patterns, for example, Gleason patterns in core needle biopsies. But of course, we can also use these algorithms for analysis of very complex data, like spatial transcriptomics or spatial proteomics data, and discover patterns in these kind of analysis. These methodologies, they're quite new. They were voted as the method of the year 2020 by Nature. And we can use them we can leverage them for understanding the disease complexity of different entities, not only cancer, but also other benign diseases, for example. And these methodologies offer us not only to discover the complexity of transcriptomes or proteomes in general, with all proteins, with all RNAs that are being translated, but also in the spatial context. So we can now use these methodologies to understand where different signalings or proteins are expressed or stemming from. Are they coming from tumor cells, for example? Are they coming from the tumor stroma and so forth? But these data are very complicated because there is another dimension added, the spatial dimension. So we're not only looking at expression of proteins or genes, but also at the spatial distribution of them. And that's why we can use AI algorithms, for example, to understand how different cells that are expressing different proteins or transcripts are interacting with other cells. And for that, we are leveraging AI, for example, algorithms like Cell Charter, for example, which is a very recent one, where we really can understand the neighborhood of cells. Okay. But we also can use AI in general to train with these very large amounts of data on patient outcomes, like therapy resistance versus very good response, and then try to understand which pathways, which proteins, or even which neighborhoods between cells are really predicting resistance or therapy response.
That's fantastic. So it's also helps you, like in research, to speed up the process of the research and to make it more clear and have a broader overview of which proteins, in terms of, if you look at the proteomics, are involved, right?
Yes, absolutely. So it is really a great tool to speed up these processes, because we're really dealing with millions of data points per a very few samples, for example. So it's really great. And it's also used by companies, for example. There are companies like Oken from France, other AI companies that are trying to use big data on the one hand, but also on the other hand, AI algorithms to understand and analyze these data for shaping precision oncology in the future.
That's fantastic. And Markus, so we see that this is a translational field where AI could really improve and speed up the process and help us for research. But I want to have a more concrete view that you can get from bladder cancer. In bladder cancer, where do you see that the impact of AI can help you, as a uropathologist, for bladder cancer? Where is a field where we can use AI?
Yeah. So spatial transcriptomic proteomics and leveraging AI for analyzing these data is really research right now. But that's a very important question, because where can we really use AI, for example, for bladder cancer? We know that it is already routine for prostate. We can use it for prostate. There are approved algorithms. But for bladder, for now, we don't have that. But there are really intriguing applications for bladder cancer, for example. Given the approval of erdafitinib based on the TOR results, for example, we need to screen patients in the future for FGFR3 mutations. And we currently have a paper in a publication process where we exactly did this together with a company from France, with Okin, to try to predict mutations from H&E slides directly, which potentially could lower the costs of molecular testing, because we can pre-screen the histology slides
to get the patient who will be more...
Right, that have a higher likelihood, and then we can say...
Likelihood to be FGFR positive.
Yes, right. And this is pretty important, because FGFR3 mutations in this indication are quite rare. So we only speak about 10 to 15%. Yeah, so we would have to spend a lot of money for testing for a very small proportion, right? And if we have a methodology that we can use for pre-screening in already available material, histology slides, we would reduce the costs.
Yeah, and I would say that it will be even more interesting for non-muscle invasive bladder cancer. We have like new studies like Moonrise 1, where we are screening FGFR for this low-grade disease. And if you have a lot of patients to screen on a molecular analysis, then if you have this kind of AI help, you can like directly go to these patients that will probably be FGFR positives. Yeah. Okay, that's very interesting. Maybe another question regarding cytology. Cytology is, in my opinion, and we were discussing it, it's still something that is very old-fashioned, the way we do cytology on a daily basis. But it has such an important impact in our patient management. How do you see that there is potential help of AI for reading cytology slides?
Yeah, sure, of course. So me personally, I hate cytology because it's so tedious. It's not only old-fashioned, it's very tedious. You really need a long time per one case, and sometimes you have hundreds of these cases per day. Yeah. And that really takes a long time. That's why we're using a lot of people, like technicians, that are pre-screening these slides. The pathologists are signing out the cases in the end, validating them. And that's a very traditional, quite expensive process. Yeah. But AI is really well suited for speeding this process up, because we're talking, for these tasks in cytology, we're talking about simple pattern recognition. We just want to classify cells in benign versus malignant. Yeah. That's what we want to do. And that's something that works very well. We know that from gynecological pap smear cytologies, for example, that it works very well. It's already used in many private practices that are doing a lot of these pap smears. But we also see that it's helpful, for example, in blood or bone marrow cytology, but also in urine cytology. There are works from a group in the United States that are really focusing on that, and they really see that you can leverage AI for predicting carcinomas or carcinoma in situ much more accurate than human readers when you use that. And you can even quantify the disease burden, and it's correlating with the time to progression, for example. So we can also draw or get more information that we're currently not able to conclude from these slides.
And I think that this is something also very important that you underlined. We know from literature that up to 57% of high-grade cytology might be different from a pathologist to another, and there is a high discrepancies between the results. And I think for big departments where you don't have maybe, or small departments where you don't have a uropathologist expert like you are, and you need to read a lot of cytologies. This kind of AI will maybe also make the pathologist more confident to read all these slides that might be a bit technical for some people, and speed up this process and the workload.
Totally. I mean, I totally agree. That's one of the biggest advantages for now and also in the future, that we can increase the confidence level of people that are not so used to certain kind of analysis, like prostate cancer, core needle biopsies assessment, but also cytology, for example. And on the other hand, we can also speed up processes. And that's something that we certainly will need in the future, because we are facing a constant shortening of pathologists in Europe, not only in Germany, but also in France and in other countries across Europe. We would need more, but we are not getting more. Yeah. That's a problem. And when the population is getting older right now, we're getting more and more cancer diagnosis by our shortening of pathologists. So we will also need AI to speed up tedious tasks like lymph node metastasis detection and so forth. So we will have to use it. It's not a matter of if we want to use it, we will have to do it.
And Markus, last question. Are you scared that AI will replace pathologists?
That's always the last question, but to be honest, I'm not scared at all, because AI is a chance for us. We will have to use it. It's not replacing pathologists, but it's helping us with keeping up with increasing workloads and also automatizing tedious tasks, but on the other hand, also compensating the constant shortening of pathologists.
It's just shaping the new way of performing pathology.
It will be a new tool, and I think it will be a great tool.
Thank you very much, Markus, for taking a bit of time. It was a pleasure to have you.
Thank you so much.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.